So, first let me ask you a question. Are you feared of diabetes? It is not the fear about the diabetes, isn't it? Many of them used to tell. It is about the complications of the diabetes what we fear. So, we know, actually we are brought up with a rice-based diet in India, isn't it? So this rice-based diet, and not only the rice-based diet, isn't it? We used to take the junk food and all, the fast food items and all, and we used to take this fermented food and all. Yeah, we think that and we believe that they are all actually good for our health. But what is happening in our day-to-day life? We know because of our sedentary lifestyle, we are not able to do the exercises, and so our blood sugar value is slightly increased, isn't it? So whenever whatever food we are taking, our blood sugar value is getting spiked up. So first, when a person is told us they are having diabetes, what they will be thinking? Okay, let me control it with the medicine. But it's not possible to be controlled with the medicine, isn't it? If it was possible to control it with the medicine, why many old age people are keeping on taking insulin? Yeah, dear. And what are the complications of insulins? If you are keeping on taking insulin, you will be thinking you are safe. No, you are not still safe. Actually, the allopathic science is trying to manage it, isn't it? And in this management mechanism, we know most of them will be getting problem with their eye, they will be having frozen shoulder, joint pain here and there, and unnecessary infection, skin problems, etc. So, in this episode, I will be dealing with some of the food items that will be helpful for you in your diabetes. So, I have made actually a video about millets. So here also I will be recommending you millets. So what is the specialty of the millets? I can tell you one thing. Decades ago, when we used to envy why our grandparents were so healthy, they had included the millets in their diet. Yes, at that time there was a lot of millet cultivation in India. So it was very good. But what is happening nowadays? We will be thinking why to use millets. So why to use millets, I will be telling you. Why we have to use millets is that actually its conversion into carbohydrate absorption is very less when compared to that of our normal grains like the rice, wheat, etc. Also, it is enriched with protein, vitamin, minerals, calcium, etc. Always we know a diabetic patient will be having nutrition deficiency. However, nutrition we are giving to their body, the blood sugar is so spiked up that it is not at all allowing the body to absorb these things. So what all millets we have to use here? Let's use ragi, foxtail millet and little millet. So the ragi, foxtail millet and little millet. We know after an age, the diabetic patients or old age patients will be suffering from constipation. So why we are having constipation? Yeah, it is because of the less fiber in our diet. So when we are taking this millets, it contains a lot of insoluble fiber. So these insoluble fiber is very good for their gut. So we can give it. And next main thing is that it is containing a lot of protein, minerals, calcium, etc. Its glycemic index is less also. So what is the glycemic index actually? Glycemic index means the conversion where the food is converted into the blood sugar. Okay, so the blood sugar conversion, that is, it is reduced actually. As soon as we take the food, the blood sugar value is not spiked up. So it is very good. So let's include these things. Not like this, we know the diabetic complication. Most of the patients used to tell, before the diabetic stage, most of them will be having this obesity stage. Whatever food or whatever drink I am taking, doctor, I am not at all getting lean. So for you also, I will be suggesting, let's start with this millets. So millets help us to reduce your body weight and help also to reduce your appetite. That is another main challenge, isn't it? So that are the specialties of these three little millets. Now let's go with a common food we used to take. So what's a common food we used to take? Yeah, oats. So oats is also very good. Why oats is very good? Oats is also containing soluble fiber in it. So oats is very good for, but if at all you are not having any digestion capacity, that is whenever you used to travel, you are having vomiting tendency and all, I will be suggesting you some rice preparations. But don't worry how you have to prepare this rice porridge preparation, that also I will be dealing in this video. So don't skip this video. So let's go with oats. So oats is containing this insoluble fiber and all, and it is having less glycemic index, so it is also safe to consume. And next main thing is that let's go with barley. So what is the specialty of barley? Actually, according to Ayurveda, barley is very good. Barley is good for the even the lean person and also for the obese person. Its glycemic index is very less. It is helping to re-establish our intestinal flora. We know nowadays most of the old patients are containing this acidity, gastric ulcer, peptic diseases, etc. So as it is containing, it is enriched in this gastric flora. It is very good. Not only this, it is containing some proteins which is also reducing the absorption of glucose in the blood. So it is also very helpful. Let's go with the diet with the barley. So barley rice, not only this, always we know a diabetic patient is under inflammation. That is always a pro-inflammation is running in their body. Because of that, most of the diabetic patients used to complain of this body aches and all. So when we take this food, it is helping to reduce your inflammation. So let's go with what we can go with barley. Next is horse gram. So horse gram, does anyone take horse gram? One of my patients asked. I can tell you one thing. When you are preparing a rasam with the horse gram, it itself will be helping you to reduce your body weight, increase your appetite and all. So horse gram is also containing insulin resistance. It is reducing the insulin resistance in your body. Yeah, and it increases the insulin sensitivity in your body. We know most of the diabetic patients will be taking insulin, but when you are taking insulin, what is happening actually? The body have to respond to this insulin, isn't it? If the body is not responding to insulin, what is happening? Insulin value is increasing in the body. So it is such a wonder drug. So I have told you about the millets here, oats here, barley here. Now, why you doctor have not told about wheat, isn't it? So wheat, dears, nowadays the wheat we use is that is mixed with the maida. And one that is mixed with the maida, will it be containing any nutritional value? No, it is not at all containing any nutritional value. So always make sure you are taking the fresh wheat that is not actually mix it with the maida. Then it will be much more helpful for you. Now, many of them I know will not be liking to take this millets in the same form. So how we can take it? Actually, we can ferment it. We can ferment it and then cook and we can take. Why I am not towards a fermented food is that most of my patients used to tell that whenever they ferment anything, that is whenever they are taking it in the sprout form, what is happening? A lot of gas is produced in their body. But if we sprout it and then we use it in the cooked form, it is actually very good for our body. So here, how we can prepare a sprout of these millets? Let's do one thing. Immerse it 6 hours in water. Then what we have to do? Then we have to tie it in a wet cloth for about 12 hours. Then let's cook and then let's take. Actually, when you're doing like this, it will be very helpful for your body. Then what all are the food that is good for the diabetic patients? Definitely you can take the green gram. Sprouted green gram, not in the sprout form. I will be telling you to cook and you can take. Next main thing is buttermilk. Buttermilk is very good because buttermilk is a good probiotic. And it is not the curd actually. According to Ayurveda, 4 things are actually prohibited not to be taken in any condition. That is excess of, you have to avoid curd, isn't it? Okay, curd you have to avoid, jaggery you have to avoid, sugary items definitely you have to avoid. Okay, then what we have to do is that we know most of the obese patients have become lean, isn't it, after getting diabetes. So let's take care of our body externally. How you can take care of your body externally? Let's give a good massage. Let's prepare an oil combination with sesame oil, ghee and castor oil. Yeah, sesame oil, let's take 300 ml and castor oil, let's take 200 ml and ghee, let's take 100 ml. Mix all these 3 combination and massage your whole body from the neck to the leg. So when we are doing like this, one thing I can tell you, it is very good in increasing the blood circulation in our body. It is actually very good in calming our nerves and all, and it is helping to increase our sensitivity also, reduces our risk of infections. So it is not hours you have to apply this, just apply it for 20 to 30 minutes and go and take a good bath in hot water. Then let me tell you two porridge preparations. It is with red rice, but don't worry, this will not be increasing your glycemic index because of the ingredients present along with it. So first, let's prepare one thing. With a little green gram and with a little brown rice, let's add a little Embolica officinalis. Okay, Embolica officinalis means it is actually amla. And along with the amla, let's add Tinospora cordifolia. It is amrit. Okay, so crush these items and let's prepare. Philanthus emblica also we can add along with this. So let's boil these ingredients and prepare a porridge in it. And if you're taking this porridge, it will not increase your blood sugar value. Next, let's prepare a beautiful preparation with milk. I know you will be frowning, why to give milk in this condition? I can tell you dears, here also the calcium absorption is not happening properly in diabetic patient. So to enhance this calcium absorption, let's prepare a milk porridge. In this milk porridge, what all ingredients do you need? Yeah, I can tell you. That is, let's prepare it with a little brown rice. Along with that, let's add a little green gram and let's add Tinospora cordifolia. Along with that, let's add that is kadukai in the Sanskrit. It means actually Terminalia chebula. And along with the Terminalia chebula, we will be adding a little Philanthus emblica also. And Siddha means actually it is very good in increasing the strength of our bones and all. Okay, that is Tinospora cordifolia. So let's prepare a porridge with this, and when the porridge is prepared, let's add a little milk to it. When we add a little milk to it, and let's take this prepared porridge at evening 6 p.m. So when we take evening 6 p.m. these, we can make sure that the diabetic patient is getting a good sleep and all, and it will be helping to strengthen their nerves and all. So I have told you some combinations. Sorry, that last two combinations, it will not be much familiar to you, but no problem. In this video description, I will be putting what all ingredients is included in this porridge preparation. Okay, hoping that these tips are helpful for you. Have a great day.